Hey, Miss BG, it's Irene. I'm doing my head-to-toe assessment, check-off validation, and I hope this isn't too rough because this is the only teddy bear I found. And I thought about using my dog, but I thought she'd move too much. So I'm gonna start out by knocking. Knock, knock, knock. Come in. Hi. I'm gonna wash my hands. I'm Irene. I'm your nurse today. Can you tell me your name and date of birth? Tells me the correct name and date of birth, and I check her wristband. Checks out okay. Okay, hello. She's gonna be Amy. Hey, Amy, I'm Irene. I'm gonna just, be taking some vitals on you today and just doing a full assessment on you, okay? And before I did all this, the room's safe. Everything's safe. I forgot to say that. There's no hazards in the way and all like that. So the first thing I'm going to do is take her vital signs, and it said to just do it verbally. So I'm going to take her pulse by doing a radial pulse, which is right here for 60 seconds. Count all that. Do an apical pulse, which is on the patient's left mid-clavicular line and right underneath, like right here. So, and then I'm going to do that, assess that, and then I'm also going to do respirations for a minute and also do blood pressure. So the two-step method is pumping it up and feeling until you can't feel a radial pulse anymore. And then after you can't feel it, that's your baseline, and then you actually just take the regular blood pressure. Okay, so after vital signs, I'm going to ask the patient, so are you having any pain today anywhere? She says, yeah, my foot hurts. Okay, what started your pain? I tripped and fell. Oh, okay, cool. On a scale of 0 to 10, how would you rate your pain? Oh, it's like a 4. Cool. How does it feel? It feels like it's shooting, it's throbbing, it's whatever it feels like. And I ask, would it radiate anywhere? Does it go anywhere? Does it go from your foot to your calf? She says no. And then when did it happen? So it happened yesterday. And then I'm also going to ask the patient, do you have any allergies? She doesn't have any allergies. And then you also walk into the room and say, is she attentive? Is she actually talking to me? Is she making eye contact? That's how you know if she's attentive, like the general appearance of the patient. And I can see her and look and see that she has good nutrition status, and the patient's talking back to me, so her speech is good. And then I'm going to ask the patient, do you have any contact lenses or glasses by any chance? She doesn't wear any glasses. Do you have any vision problems? No vision problems. And then I ask, do you have any hearing aids? She doesn't have any hearing aids. Her hearing's fine. And then also I'm going to look at her hygiene. I'm going to look at her hygiene and see if does she take very good care of herself. And obviously this stuffed animal takes very good care of herself. She's soft and stuff, so she's good with that. And then next I'm going to test her range of mobility. So I'm going to test her activity level. So to do that, I would pretty much just assess if she could walk or not. And then I'd also test muscle strength by seeing if she could push against my foot and then pull back on both foot, and then also doing an arm up and then down. And that's the range of motion and the muscle strength. So after that, I would do the temperature. I would take her temperature, take it orally, underneath the tongue, stick it in there. After it reads, stick it out. It reads 98.6, so the patient's okay. And then I'd also assess her skin. So I'd assess the color of it, if it's warm to the touch, if it's cool, if it's clammy, anything like that. And I'd assess skin trigger, meaning does it bounce right back? Is she hydrated enough? And I'd also check for moles and skin lesions or lacerations or anything wrong with the skin as well. I'd also check her oral cavity, see if there's any sores in there or bleeding or anything like that. And Next, it would be her neuro. So the patient's been talking to me. We were joking and laughing, and that would be assessing her level of consciousness. She's ANO times 4. She knows where she is. She knows her name. She knows the president. She knows how many quarters are in a dollar, how many dimes are in a dollar, everything like that. And then I'd also take my pen light after assessing that she's obviously fully alert and go back through one eye and then look in her other eye to make sure that her pupils are dilating and constricting equally and reactively, which would be pearl. Pupils equally reactive. Pupils are equally reactive to light, and then you also need to know accommodation, which is did both eyes accommodate to the senses looking. Next is does she have any facial expressions like facial drooping, any signs of stroke, slurs in her speech, one side's weak, another side's weak. Her communication's good. She's been talking to me, obviously. I would assess her swallowing. Can she swallow pills okay? If she can't swallow pills okay, I'm going to have to give her medications a different way. After that, I'm going to assess her respirations. So I already counted her respirations per minute, but then I'd want to auscultate. So auscultating we do from side to side. So you want to start all the way up top. Here, 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 and then keep going down, and then on the sides, and then you do this pretty much the same on the back. And so once I listen to that, I want to make sure there's no adventitious sounds and all the lung sounds are clear. Nothing's wrong with it. I don't hear any wheezing or crackling or any fluid in there at all, because that's not good. After that, I want to assess her cough. So I'd ask her, do you have a cough? She says, no, I don't cough. And then I don't have a cough. And then I'd ask her to cough and see if there's any mucus that I don't want in there, any brown stuff, any green stuff or anything like that. After that, I'd go on to the apical pulse, like I already said. It's the patient's left midclavicular line, and then you go down to the 5th intercostal space. It's like right underneath the breast, right here. And it's really hard to do this because I'm like looking at myself, and it's the opposite. I want to listen to the apical pulse for the S1 and S2 sounds of the lub-dub and make sure that that's there and there's no skipping or it's not fast or anything, and it matches with my peripheral pulse that I took earlier. So that would be the heart sound. And then after that, I'd make sure that she has a good cap refill. So the cap refill is right here. I want to make sure that's less than 2 seconds. And so I check that. It's good. And then after that, I want to check for edema, any pitting in her legs, especially on bony prominences. And I check her all for that all the way down, mostly on her legs, and I don't find any fluid buildup in her lower extremities or anything. After that, I would want to check her pedal pulses and her tibial pulses. So right here on the top of your foot. I didn't plan how to assess my pedal pulse, but I'd want to make sure that both pedal pulses are strong and there, and also the tibial ones too. After I assess that and both extremities get good circulation, I want to assess her voiding, her bowels, I want to assess her bowel sounds. So to assess her bowel sounds, I would start right lower quadrant and then go counterclockwise. So I'd start here, 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 and then I'd want to listen to make sure that there's a bowel sound about every 5 to 10 seconds, and if it's over a minute, then that's hypoactive bowel sounds. So, and then I'd want to check her consistency of feces And then after I check her feces and stuff, then I would go on to urine. So I'd want to make sure her urine's a good color, so no foul smelling, no foul smelling stuff, and nothing cloudy or anything. And I also forgot I'm supposed to palpate. I would have also palpated the stomach, the abdomen for any firmness, just like listening. I'd go in each quadrant. So this would be my left upper quadrant, right upper quadrant, lower right quadrant, lower left quadrant. Sorry, I'm like looking at myself and it's the opposite. So after that, I think I assessed everything to my knowledge. And so after that, I'd ask my patient if there's anything that she needs. I'd give her call light. And after that, I'd leave the room and wash my hands. And yeah, I think that's it. Hopefully this was good enough. I didn't know what to expect, so hopefully this was good enough. And hopefully my dog gives me brownie points. So thank you.